What I'm about to explain today may sound surprisingly small at first, almost harmless, because for many adults over 60, it starts as nothing more than a strange sensation in the middle of the night. You wake up, maybe your fingers feel asleep, maybe your hand feels swollen even though it looks normal, maybe there's tingling in the thumb, numbness in the fingertips, burning in the palm, or a strange pins and needles sensation that forces you to shake your hand awake in the dark. And after enough nights, most people start telling themselves the same thing. It's probably just aging, but sometimes it isn't. Because one of the most overlooked warning signs doctors pay attention to in older adults is nighttime numbness in the hands. Not because every case is dangerous, most are not, but because the body often starts revealing deeper problems quietly, subtly, long before more serious damage develops. Nerve compression, circulation problems, vitamin deficiencies, blood sugar dysfunction, neck degeneration, inflammation, sleep posture, even early neurological or cardiovascular changes. And honestly, what makes this so concerning is that many people ignore these symptoms for months, sometimes years, because the discomfort seems minor compared to everything else happening in life. But the body whispers before it screams. My name is Dr. Adam Scott Levin, and for more than 15 years, I've worked with adults dealing with nerve disorders, metabolic dysfunction, inflammation, circulation problems, age-related neurological changes, diabetes, spinal degeneration, sleep-related symptoms, and the subtle patterns the body often shows before bigger health issues fully appear. And today, I want to walk you through something incredibly important. Why your hands may go numb at night after 60, what hidden causes doctors often look for, which symptoms are usually harmless, which ones deserve more attention, and why these nighttime sensations are often connected to much bigger systems inside the body than most people realize. Because once you understand what's actually happening beneath the surface, you start looking at numbness very differently. Before we go deeper, I want to ask you something. Have you ever woken up with numb hands at night? And if you have, which fingers usually go numb first? The thumb, the pinky, the entire hand? Drop your age and experience in the comments below because honestly, many people watching these videos realize for the first time that they are not the only person dealing with this. Now here's where things start becoming very interesting. Most people think numbness simply means bad circulation. And yes, circulation absolutely can play a role. But medically, numbness usually involves nerves. And nerves are incredibly sensitive structures. They respond to pressure, inflammation, blood sugar changes, vitamin deficiencies, posture, swelling, oxygen supply, spinal compression, even chronic stress. And nighttime becomes especially important because while we sleep, the body stays in the same position for long periods of time. That matters enormously. Because many forms of nighttime hand numbness are actually positional at first. I remember one man in his late 60s who kept waking up around 2 or 3 in the morning with his right hand completely numb. He thought he was losing circulation in the arm, but when we talked more carefully, something interesting appeared. He always slept with his wrist bent underneath his pillow. And over time, repeated compression of the median nerve inside the wrist had started creating classic carpal tunnel symptoms. Now, here's what many people don't realize. Carpal tunnel syndrome is one of the most common causes of nighttime hand numbness in adults over 60. Inside the wrist, there's a narrow passageway called the carpal tunnel. Several tendons and the median nerve pass through that tight space together. When swelling, inflammation, repetitive strain, arthritis changes, or fluid retention narrow that space even slightly, the nerve becomes compressed, and nighttime often makes symptoms worse. Why? Because people naturally curl their wrists while sleeping, fluid shifts slightly while lying down, tissue pressure changes, and the compressed nerve begins sending distress signals. That's why many people wake up shaking their hands at night trying to wake them back up. Now here's the fascinating part. The exact fingers involved often give doctors clues about where the problem may actually be coming from. If numbness affects the thumb, index finger, middle finger, and part of the ring finger, doctors immediately start thinking about median nerve compression and carpal tunnel syndrome. But if the pinky finger and outer side of the hand go numb, that points us toward a completely different nerve, the ulnar nerve. And honestly, this surprises a lot of people, because the ulnar nerve often becomes compressed near the elbow rather than the wrist. I remember one retired truck driver who kept waking up with numbness in his pinky and ring finger every single night. He assumed poor circulation was causing it, but eventually we realized he slept with his elbows tightly bent for hours at a time. That prolonged compression near the cubital tunnel around the elbow was irritating the nerve repeatedly during sleep. Once he changed sleeping posture and reduced elbow flexion overnight, his symptoms improved dramatically. And honestly, this is why doctors pay such close attention to patterns. Which fingers? Which hand? What time at night? Any neck pain? Any weakness? Any daytime symptoms? The body leaves clues constantly. Now here's where things become more serious sometimes, because not all nighttime numbness starts in the hand itself. Sometimes the problem begins much higher. The neck. As we age, the cervical spine slowly changes. Discs lose hydration. Arthritis develops. Bone spurs form. Spaces where nerves exit the spine can narrow gradually over time. This is called cervical radiculopathy. And when nerves become compressed in the neck, symptoms can travel all the way down the arm into the hand. Many adults describe numbness, burning, electric sensations, arm heaviness, weak grip strength, or pain radiating from the shoulder downward. And nighttime often intensifies these symptoms because sleeping positions place additional pressure on the cervical spine. I remember one woman in her early 70s who kept treating her hand numbness with wrist braces for months without improvement. But the real issue wasn't her wrist at all. Imaging later showed severe cervical arthritis compressing nerves in her neck. And honestly, situations like this are exactly why self-diagnosing online becomes so risky sometimes. Because very similar symptoms can come from completely different causes. Now, this next contributor has become incredibly common in modern medicine: diabetes and blood sugar dysfunction. Because elevated blood sugar can quietly damage nerves over time through a process called diabetic neuropathy. And what makes this particularly dangerous is how slowly it often develops. People don't suddenly wake up one day with severe nerve damage. It usually starts subtly: mild tingling, occasional numbness, burning sensations, pins and needles, changes in temperature sensitivity, and over time, nerves become less efficient at transmitting signals properly. Many people notice symptoms first at night because external distractions disappear and the nervous system becomes quieter. That's when abnormal sensations suddenly feel much louder. I remember one patient who described it perfectly. He said, "During the day, I barely notice it, but at night, it feels like my hands are buzzing." And honestly, that description is extremely common. Now, here's something many adults over 60 never hear clearly enough. You do not need severe diabetes to begin experiencing nerve changes. Prediabetes alone can affect nerves. Insulin resistance can affect nerves. Inflammation can affect nerves. Poor circulation can affect nerves. The nervous system is deeply connected to metabolic health. And this is exactly why numbness sometimes becomes an early warning sign doctors take seriously. Now let's talk about another hidden issue that quietly affects millions of older adults: vitamin deficiencies, especially vitamin B12 deficiency. Because vitamin B12 plays a critical role in nerve function and nerve insulation. Without enough B12, nerves struggle to transmit signals properly, and symptoms can become surprisingly widespread: numbness, tingling, burning feet, balance problems, fatigue, brain fog, memory changes, weakness, even mood symptoms. What makes this especially important after 60 is that aging itself changes absorption. The stomach produces less acid. Certain medications interfere with B12 absorption. Digestive disorders affect absorption. And over time, deficiency can slowly develop without obvious warning signs. I remember one older gentleman who was terrified he had a progressive neurological disease because his hands and feet kept tingling constantly. But blood work later revealed severe B12 deficiency, and after proper medical treatment, many of his symptoms improved significantly. Now, again, not all numbness is caused by vitamin deficiency, but it shows how interconnected these systems truly are. And honestly, this next cause may surprise even more people: poor circulation. Now, earlier I mentioned that most numbness involves nerves more than blood flow, but circulation still matters enormously because nerves depend on healthy blood supply. When circulation becomes impaired, nerves suffer too. Conditions like peripheral artery disease, smoking-related vascular damage, uncontrolled blood pressure, cardiovascular disease, and chronic inflammation can all reduce blood flow efficiency over time. Some adults notice their hands become cold easily, pale, bluish, slow to warm up, weak, or numb during certain positions, and nighttime can magnify these sensations because circulation naturally shifts while lying down. Now, this does not mean every cold hand is dangerous, but persistent circulation changes deserve attention, especially alongside pain, weakness, color changes, or exertional symptoms. And honestly, one of the biggest problems in modern health culture is that people normalize symptoms gradually until abnormal starts feeling ordinary. Now, let's talk briefly about inflammation, because inflammation sits underneath far more symptoms than most people realize. Arthritis, obesity, autoimmune disease, poor sleep, chronic stress, processed diets, sedentary behavior, all of these can contribute to inflammatory changes that affect joints, nerves, blood vessels, and tissue swelling. And inflammation creates pressure. Pressure inside the wrist, pressure around nerves, pressure inside joints, pressure inside the spine. This is one reason symptoms often worsen at night after physically demanding days. The tissues become irritated, swollen, compressed, and the nervous system responds immediately. I remember one woman with rheumatoid arthritis who said nighttime was the only time she truly noticed how inflamed her hands had become. During the day, she stayed distracted and active. But once her body became still at night, the burning and numbness became impossible to ignore. And honestly, that's something doctors hear constantly. Nighttime removes distraction, the body becomes quieter, and symptoms suddenly become more noticeable. Now here's something else incredibly important. Stress itself affects nerve sensitivity. Many people think stress only affects emotions, but physiologically, chronic stress changes muscle tension, inflammation signaling, circulation, cortisol balance, sleep quality, and nervous system sensitivity. Over time, the nervous system becomes more reactive, more amplified, more aware of sensations. This doesn't mean symptoms are imaginary, far from it. The sensations are real, but stress changes how strongly the brain and body process discomfort. I remember one patient who noticed her numbness became dramatically worse during periods of emotional stress and caregiving exhaustion. And once her sleep improved and stress levels stabilized, the nighttime symptoms became far less intense. That overlap between emotional and physical health is something modern medicine is finally starting to understand much more deeply. Now here's where doctors become especially careful. Weakness. Because numbness alone is often less concerning than numbness combined with weakness. Difficulty gripping objects, dropping things repeatedly, muscle wasting near the thumb, loss of coordination, difficulty buttoning clothing. These symptoms may suggest more significant nerve involvement. And if numbness appears suddenly alongside facial drooping, speech difficulty, severe dizziness, or one-sided weakness, emergency medical attention becomes extremely important because stroke symptoms can sometimes overlap with nerve-related symptoms. That distinction matters enormously. Now here's the part I really want people over 60 to understand. The goal is not fear, the goal is awareness. Because not every tingling finger means serious disease. Sometimes people simply slept awkwardly. Sometimes a nerve becomes mildly irritated temporarily. Sometimes posture is the issue, but persistent patterns matter. Repeated nighttime numbness matters. Progressive symptoms matter. Changes matter, especially when symptoms slowly worsen over time. And honestly, one of the most dangerous habits adults develop is learning to dismiss their body automatically because they assume every symptom is just aging. Aging changes the body, absolutely, but many symptoms people blame on aging actually reflect treatable problems underneath the surface. And perhaps the biggest hidden truth in medicine is this. The body usually gives subtle warning signs long before major dysfunction fully develops. That's true with nerves, circulation, metabolism, heart disease, sleep disorders, inflammation, almost everything. The challenge is that modern life teaches people to ignore subtle symptoms until functioning becomes impossible. But biology still matters. Sleep still matters. Blood sugar still matters. Movement still matters. Inflammation still matters. Posture still matters. And nerve health absolutely matters. I remember one patient telling me something I've never forgotten. After finally addressing severe nerve compression that had been progressing for years, he said, "I thought numbness was just part of getting older. I didn't realize my body had been asking for help the whole time." And honestly, doctors hear versions of that sentence constantly. So here's the final takeaway I truly want you to remember. If your hands occasionally fall asleep at night, don't panic. That can happen to almost anyone. But if numbness becomes repetitive, persistent, painful, progressively worse, or starts affecting strength, coordination, sleep quality, or daily function, don't endlessly rationalize it away either. Pay attention calmly. Look at the full picture. Your blood sugar, your posture, your neck, your sleep position, your stress levels, your circulation, your medications, your vitamin levels, your inflammation, because sometimes the body is simply responding to temporary irritation, and sometimes it's quietly revealing deeper imbalance long before more serious damage develops. The key is learning how to listen carefully, without fear, but also without denial. And honestly, that balance protects far more people than most realize.